How are you doing?
Hey Bruce, how are you?
I'm doing great.
Yeah, I enjoyed your video. I still use a forcep to hold the eye, but I guess this Friday I'll be trying the no forcep technique. Right.
Yeah,
Right.
you know what I found was that I you know I liked securing the eye quite a bit, but I found it I learned this from Rex was maybe putting like a Wexel that had some alkane on it, on the conj, and it just made it easier for patients because sometimes they would complain about feeling it.
Right.
Um, and then I saw somebody else do that, and I was like, oh, let me try it, and it's actually become like a thing now. Like patients really seem to do well. But I do think it adds time to me getting the lenticule out. I will say that. But with the 800, I mean, as you can see, the lenticules come out so nicely. It's
Right.
amazing.
It's just really been a game changer. I've been doing refractive surgery for 24 years now, and it's just interesting just to see the progression of technology. We started off with microkeratomes,
Right.
then the intralace, and then the VISUMAX 500, now the 800. It's just really been just amazing to watch things progress. But I think the thing that we've enjoyed the most is just the speed. The patients have just been just wowed by that. I did a guy just 2 days ago. He had actually driven 9 hours to have surgery with me because he specifically wanted the surgery with the VISUMAX 800.
Yeah.
And even he was surprised by the speed. Yeah, he was just raving about it after. Right. So
You
it's
know
just,
what's interesting is that I'm surprised at how much research or how educated some patients are because a lot of people have actually, before we got the 800, a lot of people would actually call and ask us, did we have it yet or when we were going to get it? And that really surprised me because I didn't really think, as you know, it's
right.
just people doing smile, period. You
Yeah.
know, people are still kind of learning about it. And so for someone to call and actually ask about a particular laser,
Right.
I think it's pretty interesting. But yeah, like I'm surprised at how many people ask us whether we have it, and they ask specifically because it's so much faster.
Right. Now that's true. And then just with Smile in general, just the fact that you don't have to worry about flap complications. You talked about the fighter that you did. During the pandemic, remember the MMA fighters were going overseas to fight. So we happened to do a professional MMA fighter during a time where they thought they were going to have a bunch of time off. And then I remember I saw them at their 1 week appointment and they told me, oh, by the way, I'm going to be fighting in 4 weeks. LASIK, the answer would have been no, but
Yep.
Smile, so they went and had their fight. They did well, no issues. So it's just an interesting, just a wonderful procedure.
Yeah. So I'll tell you. So that particular patient was actually my son,
Oh,
and
okay. Wow.
my wife had LASIK, and my wife was like, "There's no way he's going to be able to go back to do, MMA after he gets surgery." And I'm like, no, 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 this is totally different. And so she was, reluctant to let him do that. But I mean, he did great. And as you know, I mean, it's definitely an amazing procedure. So for me, um, I kind of went all in. I don't do a lot of LASIK, and
Right.
so I'm strictly Smile.
Uh-huh.
For you, how has it been for you in terms of like,
So I
people?
do, I mean, obviously, we offer the whole suite of refractive surgery, but I would say I probably do about 85% Smile, maybe 15% LASIK. And I'm not doing PRK anymore. So I actually, we have someone else in the practice that's able to do those. But Smile is the main laser refractive procedure I perform.
Yeah, I mean, we offered everything, but it's crazy. We've been open for 2 years, and I've probably done 6 LASIK.
Oh, really? Oh, wow. Wow. Wow.
Yeah, yeah, because in the Washington D.C. area, there's really nobody else doing Smile. In Baltimore, you've got Sunny, who does a lot of Smile, but in the D.C. area, so most people come to us because they really want to Smile.
Exactly. Right.
Yeah, yeah. I think that also just the way the laser looks to me,
It's
it's
just, yeah, it's just and at the very beginning, I thought the robotic arms would freak out the patient or make them, anxious. And it's been the opposite. They love it.
No, I agree. I agree. I think that, and just the way it looks in the clinic, it's just an amazing thing. So,
Exactly.
hopefully more people get it, and we start to see this turn to lenticule extraction over LASIK, which I think is going to happen in the next few years.
I think it's what's going to happen in the future. It's one of those things. It's just
Yeah,
the evolution of technology. And then just speaking lastly, just the visual recoveries, we're seeing a lot faster visual recoveries. In the past, the LASIK patients probably recovered a little bit quicker, but these days, since we've had this laser for about 3 months now, I mean, very, very similar to LASIK at this point.
yeah. Once things are optimized, I see no difference whatsoever. I mean, I think patients are super happy. I actually had a patient. I did LASIK one eye and Smile on the other eye, actually on the 500 because he did move, and I got a suction loss. And he swears he's 2015 in both eyes. But he swears that the Smile eye is better. And I keep telling him like, you're 2015 in both eyes. So
Right.
once things are dialed in, I mean, the results are amazing.
They really are. They really
Yeah.
are.
Well, thank you so much for sharing and spending some time with us tonight. I wish John was here. It would have been good to get some of his feedback as well. He's been doing Smile longer than both of us, I think.
Right.
But no, I really appreciate you being on, and thanks,
No,
guys,
thanks,
for
thanks
putting
for
this
having
together.
me on, and thanks to the meeting organizers for inviting me. Right.
Yeah, thank you. Have a great night.
All right. Very good. Good night. Thank